Oh, there we go. We're all connected. Hi, everyone. I'm Sarah Stackhouse, reporter with RNCN, and I'm here with Sally Fryer-Dietz, who is a doctor of physical therapy and the founder of Integrative Concussion Therapy and Integrative Pediatric Therapy. Thank you so much for joining us.
Thank you.
Yeah, so we have a lot of questions for you. I feel like no one really knows that isn't in the field. You know, what is a concussion? You know, what does it, how do you get one? What are the treatments? I feel like we've heard so many different things for so many years. We're here to get the real answers now. Okay. So, is there any way to really prevent a concussion or make sure that it doesn't happen to you?
Well, you know, none of us can walk around with bubble wrap all around us. We're all susceptible to a concussion. Mm-hmm. You don't have to be playing sports or doing anything particularly risky to sustain one. That puts you at a greater risk, possibly, of getting one. But, you know, any of us could step off a curb or be in a car accident or anything else that can cause a concussion or injury to the head.
And tell me a little bit about kind of your backstory with researching concussions and how you kind of got into studying this.
Okay, well, so working with kids for a long time, and would get referrals for individuals who would have a concussion and had symptoms like headaches and fuzzy thinking and not processing schoolwork or having trouble in school. And those were all very similar problems to what we would see in our pediatric population with kids who had learning differences or learning challenges. So seeing that similarity between those two groups, we really began to look at, well, what are some of the causes of these problems, and are there things that we can do to help address them? One of the first things we do is the craniosacral therapy that helps to calm everything down and helps people really to feel better after an injury. But then, you know, there could be longer effects, like with your vision and your vestibular system, that require some kind of therapy afterwards to really heal completely.
Well, I guess then that kind of brings us to another question. Do you always see the symptoms of a concussion right away?
No, you don't, and that's what makes it so tricky. You know, you could have somebody who they're out on a soccer field and they get hit hard, and they stand up and they're kind of a little wobbly, but they say, "Oh, I feel fine, I'm fine." And the coach says, "Okay, well, you can keep playing." And that's not a good call, you know, because a lot of times those kids, even, you know, you have a hit hard enough, you can kind of move through it, and those symptoms may not show up till that night, the next day, and even sometimes weeks or months later.
So what should parents be looking out for, coaches? What should they all kind of be looking out for when it comes to on the field, or even just if your child is playing around the house and they fall down or, you know, hit something? And really, do they have to hit their head? I mean, are you looking out for that?
It really comes down to the mechanism of injury. So if you're watching somebody playing a sport, or your child, you know, falls down the stairs or something, you see something that causes an insult to the body, you know, first of all, you know, look and ask them, you know, how are you feeling? Look at their eyes. Do they respond right away? Are they wobbly? Any kind of mechanism that looks like it's hard enough is cause to worry. Certainly on a field, if you see somebody get hit hard, you know, maybe they need to sit out and, you know, go through a concussion sideline assessment and just see, are they showing any signs of some confusion or anything, and have it repeated at least 5 minutes later and then 15 minutes later to really be able to sort out, have they been hit hard enough to warrant staying out of the game.
So what are some of the, you know, you said kind of run through a little bit of a drill 5-15 minutes after. What are some of those movements or practices that you can, you know, if you see your child fall, what should you be asking them?
Right. So the first thing is just to look at their reaction time. Can they get up by themselves? You don't ever want to help somebody up off the field.
And you would never think that.
Right. The first inclination is run out there and, you know, help them to get up. But you really want to see, how do they get up? You know, are they unsteady at all in how they get up? You can have a hard hit to the tailbone and have it affect your brain.
I would never assume that.
You don't have to necessarily, you know, crash heads. So, you know, looking to see how they move, noticing, is there any confusion at all? You know, do they know, you know, where they are, what day is it, you know, what game are they playing? You know, even just simple sorts of things that you might assume they do know, they may not know that right away. You can have retrograde or, you know, amnesia on either side, where you forget what happened before the game, or you can forget everything that happened after you were hit. Wow. So antegrade or retrograde amnesia, can be common in something like that.
Well, and I actually just recently saw here a question. Let me see. What actually happens to the brain when you do get a concussion?
Okay, so it's kind of like you bruise the brain. You have a concussion. Your brain is encased in your skull. It's a nice, hard
nice
surface.
Hard,
but you've got fluid that surrounds it, and you have, fluid that makes up the brain. It's very, very fluid. So it's like a big jelly bowl. So when you hit it hard, that whole brain throws itself against your skull, against this hard cavity. And when that happens, you have these little, axons or little neurofilaments inside that can kind of break apart. So when that happens, that causes an injury or like a bruise to the brain. The first time you have a concussion, it may just, break them apart partially. But if you have another one on top of that, that's where you can run the risk of really sustaining a much more severe injury, or where the multiple concussions comes in to be a bigger and bigger problem for people.
So if you think your child may have a concussion or, may have something going on, what do you do?
Well, you really need to take your child to the physician, take them to somebody who understands and really knows concussions and signs and symptoms. Your school should have a concussion plan in place, whether it's a private school or a public school, so that there's somebody who's really qualified on the sidelines to do a sideline assessment and documenting exactly what they're finding. If you're at all concerned about if your child may have sustained an injury, or yourself or anybody else, go to the physician and have them do a neurologic check. They can look and see what's going on with the eyes, take a good history. If something is not quite right and you're not getting the answers that you need, find somebody who truly is a concussion specialist. There are lots of physicians and even emergency rooms that may or may not be completely up to speed with what current concussion protocol is and all the different treatments that are available. So it's very important that you find somebody who knows what they're looking for and is trained to see those subtle signs of any kind of a head injury, which is what a concussion is.
And you're talking about some of these signs, and something else we've discussed a couple of times is having really a baseline for where you're starting from. So you can see those differences, right? Can you tell us a little bit about what is a baseline and why something like that's so important?
Yeah, so, when we talk about, so how can we protect our kids? We want our kids to be able to play sports. We want them to be active, and we want them to have healthy...
You have two healthy, active sons, right, who played sports all the time?
Yeah, I had a rugby player and a football player. But how do we set our kids up to be safe? Mm-hmm. That's what every parent really wants to do. They want their kids to be safe. They want them to enjoy life. And, one way that you can do that is by having a really, really good baseline assessment, where it's not just doing an impact test, which is a neurocognitive test, but doing the impact, looking at how they're processing information, but also looking at their vestibular system, their balance reactions. Where do they hold their balance? Lots of kids who are in constant motion don't necessarily have really good balance when they have that static control. They're always moving because it's harder to stand still. So having a good balance assessment tells us a lot about their vestibular system and the state it's in. Also looking at their visual pursuits, how their eyes work and visually track. Kids, many times, it can be associated with learning differences if your eyes aren't teaming together or really tracking efficiently. And after an injury, that is something that very often gets affected. So by having a good baseline, you really know what's going on before there's an injury, so that if there is an injury, we know what we can get back to. The other really good thing about a baseline assessment is if there are red flags apparent that the child is masked, say they're having more trouble than somebody else in copying things off the board, so they're a little slower in their academics. They're doing fine. They're getting good enough grades, but it's more of a challenge for them. They may be able to get away with that before an injury, but afterwards, everything falls apart. So if you see these red flags show up early, there are things you can do to treat those before it becomes a problem on the field. Wow. And that way, when they get out on the field, they're less likely to be set up for an injury. than they might otherwise be. Especially when we look at peripheral vision, and when
Ball comes in from over
that's
here.
right. Whether you're playing soccer or lacrosse or football or even tennis, you have to be able to focus on what's right in front of you, but take in everything else that's around you. And with the increased usage of cell phones, where everybody's focused, right in front of them, we're losing that peripheral vision, which is what really does protect us on the field and on the sidewalk or anywhere else, where you sense that something's coming in from the side, so you can react to it before you get blindsided.
And, that's something I wouldn't even think to do or think about initially if I hadn't, if we weren't talking about this. So that's some really good advice. And you kind of touched on a topic on the cell phone. A lot of times we've heard physicians or doctors say, okay, now get some mental rest if they think you have a concussion or something like that. What does mental rest mean? At home, can you watch TV? Can your child, text on the phone?
Right.
Everyone has phones now, or go on the computer. What is rest?
So your brain is always working. Whether it's you're just using your eyes, you're watching a movie, you're looking at a book, the visual cortex is a major part of your brain. So anytime you're engaged cognitively, using your brain to think, even having a conversation, watching something, texting your friends, takes a lot of mental energy. And when you sustain a concussion or any kind of even subconcussive forces in some cases, injury to the brain, there's a chemical reaction that takes place that causes this bruising of the brain. And all that, if you imagine you've got a snow globe and you shake it and all those little pieces are all kind of floating around, you really want everything to settle down. So, it used to be they would put people in bed rest for 2 weeks. We know that's not good to do anymore. Okay. Now the standard care is really for the first 24 to 48 hours rest. No, TV, no music, just chill, sleep. Don't be waking up your kids every 10 minutes, every hour to check and see if they're still awake.
That was my next question. I remember when I was younger and I got a concussion, they said, don't go to sleep right away.
Because they were worried about a brain bleed is the big thing. Obvious things that can happen that are very dangerous, obviously, that you're going to warrant going immediately to the emergency room would be if there was any kind of clear fluid leaking from the ears. That could be cerebral spinal fluid, bleeding, risk of a skull fracture, your more severe kinds of reactions. The pupils, aren't reacting appropriately or aren't following, and then that warrants a emergency, 911 kind of a situation. But for kids who are alert and oriented, watch and see what their cognitive status is. If anything changes quickly and they start getting more confused, that's an emergency setting. Okay? So any change going in the wrong direction, you want to get checked out.
Right. Okay. And I think we have another question here. Let me see here. What is done in therapy? Are drugs necessary?
So, great question. Thank you for asking that. Sometimes, or more often than not, drugs seem to be the first line of defense. And in our experience, and in most of the medical literature, while sometimes that can help to calm the brain down initially, many times those drugs can get in the way of treatment and can get in the way of really a full recovery. If your drugs are masking your symptoms are telling us what's going on. Right. So when we want to progress somebody through therapy, we want their brain to heal completely before we put them into a risky situation again. It takes 3 to 4 weeks for the brain to heal, even in the mildest of concussions. So, if you add medication too early and the person's feeling pretty good and they go back to school, a week or two later, but their brain isn't healed, but they feel good because they've got, a drug on board, they're more likely to do something that could actually hurt them a second time. Your reaction time is still a little bit off. You really have to look at the big picture. Wow. So, perfect world, you get a good assessment early on. Mm-hmm. Medication isn't necessarily the first line of defense. Let's see what's going on, how much you heal on your own, and then have a good progressive rehab protocol with somebody who knows what they're doing, that is looking at their vision, their visual motor pursuits, looking at their balance systems, what's going on with their balance, what stirs up their symptoms. When they go to school, do they need accommodations? Can they, or are they able to go to school all day long and feel fine at the end of the day? If you go to school and you come home and you have a horrible headache and you go to bed, that's too much. So clearly you are not ready to go back to sports or anything else. We really need to, get you through a full school day without symptoms, and then we start adding, more return to play kinds of activities on top of that. The biggest mistake people make is to do too much too soon, or to not do enough.
Oh, wow.
So there's a
just a medium there.
Right place in between. Yeah.
And that was, let me see here. That was a question from Lorraine Stedman.
Okay, great.
Okay. I'm going to put this down here. So another question we kind of had, what are some of the treatments that, you're very familiar, you do a lot of the treatments here. What are some of the treatments that don't involve drugs, obviously, that can be done?
So one of the, it's like the silver bullet of all this stuff that we actually just finished a pilot study with 2 groups of ex-NFL players to show the effectiveness of this treatment, but it's called craniosacral therapy, and it's a very gentle, non-invasive therapy that works directly on the central nervous system. So it helps the whole body to relax, especially your autonomic nervous system, which when you've been hit, your body tenses up and it gets, it's like on hyper alert. So this helps with all that muscle relaxation. Many times if you've been, whether you've been injured on a field or in a car accident where you have a whiplash injury and the muscles of the neck are very, very tight, it will help to relax those muscles. That tightness of those muscles in itself can cause headaches and lots of other secondary symptoms. So the craniosacral therapy is one of those things that you can come in and have a great treatment and you leave feeling better. And when we first started working with concussions, that's really what we did exclusively, was just this craniosacral therapy, because it helped everybody feel better and they went home. But what we found is if you do have those underlying vestibular and visual deficits still, they really do take some rehab and some retraining of those muscles. So we can help calm everything down, but we still need to do the work to get those systems to work better for us.
Okay. And you said it's non-invasive. What exactly is it? It sounds very interesting.
So it's a light touch manual therapy, meaning we use our hands, and it's used over the body, over the clothing. It's very non-invasive. It works with the tissues of the body, what we call fascia and connective tissue, and there's you use your hands and you wait for that relaxation response. And so we're working with the tissues of the body to allow it to relax under our touch. And the therapist is really trained to feel all those subtle changes throughout the whole body. It was developed by an osteopath, Dr. John Upledger, who really brought the technique more into mainstream and taught lots of cross disciplines how to use this very, very light touch in a way that can be very beneficial for lots of different things, but especially for this.
That's so interesting. I would never, never think about that. Well, I guess one other thing that I wanted to know, is there anything else that you think, let me double check with questions here. Yeah, I think we're good with questions. Is there anything else any other questions you frequently get, or anything else you think people would want to know about concussions, or looking out for them, or treatment-wise?
I think, the biggest takeaways are, know your kids, go to your kids' games, watch them play, be keen observers of behavior, especially when we get into adolescence. Kids can be, things can show up, and it can be passed off as being a moody adolescent, but knowing what your child's history is on the field or anything else, you can begin to associate if something just doesn't feel quite right. Listen to that. Listen to your gut feeling. And again, look for a specialist, not just, somebody who, has a shingle over their door, but somebody who really, really knows concussions and works in active concussion rehab and understands all of the symptoms or all of the systems involved, not just, athletic training or not just vestibular or not just, one thing or another, but somebody who really has a global perspective of, all the different things that can, cause some of these symptoms that we're seeing, and get a good assessment and look at that and see what we can do, because there really are a lot of things that you can do and you can heal. And if you can heal early, you're going to be better off than if you wait 10 years, even though we were able to help, people years down the line, as we proved with the ex-NFL guys. But
ideally,
yeah, there's, who needs to suffer for that long? Yeah.
Well, Dr. Sally, can you tell us kind of where you're located, and if people have questions that they weren't either able to ask here or they're seeing this later and they want to ask you, how can they get in touch?
Okay, so we have two websites. One, concussion-therapy.com. We are in Dallas, Texas. We also have Integrative Pediatric Therapy, which is iptkids.com. They're both sister companies. Lots of overlap there in what we do. But for concussions, we work with kids through adulthood, every age. We see lots of, seniors even who have fallen, and you didn't break your hip, but you hit your head and somebody didn't quite pick up on it. And so, there's lots of people who need help out there. And no matter how long you've been after a particular injury, if you're suffering from something, certainly, look into the options, because there are treatments that we can do to help you recover better and feel better, have a better quality of life.
Okay, and is there an email or a phone number people can call if they have questions?
Yeah, if you want to email me, you can email me at Sally, SALLYF, at iptkids.com, and I'd be happy to answer your questions.
All right. Well, again, for those who are just joining now, Sally Fryer-Dietz, doctor of physical therapy, founder of Integrated Concussion Therapy and Integrative Pediatric Therapy. Thank you so much for joining us, and a lot of really helpful information that I think a lot of us don't really or might not have heard before. So thank you for joining us.
Right. Thanks so much. Yeah.
Of course. All right. Well, we'll see you later. Oh, hold on one second. Actually, we have a question from Rodney before we go.
Okay.
All right. Let's see. What is the timeline for symptoms? I'm guessing some might not be recognized immediately.
Yes, you're right. And that's, again, what makes it so tricky, because, especially with kids and adolescents, they are very team-spirited and don't want anybody to know that they're not 100%. So those things can show up, like I said earlier, days later, even weeks and months later. So if you see patterns in your kids where grades begin to slip, they begin to withdraw from activities that they used to really love, they're moodier than usual, just something's off, that can be related to an injury. Same thing, we also know that multiple injuries, even the subconcussive hits, you don't even have to have a full concussion to have some of these cumulative effects. So, knowing what your child's lifestyle is and how much they've been banged around, and putting that together with their behavior is a good rule of thumb.
And if they have any questions, about the exact symptoms, or they say, my kid has this, this, and this, they can give you a call or shoot, call over to the center, right?
Right. And on our website, we have a good list of, what are the signs of a concussion? What are the different treatments that are available? Dizziness is probably one of the most prevalent symptoms that we get. So anytime anybody has any symptoms of dizziness, there's lots of different reasons that can be. So, you want to have a good evaluation. You can have the little crystals knocked out of your ears, which might just take one treatment to be able to fix if it gets identified correctly. Or, it could be from medications that somebody was given and they didn't quite figure that out. So, just understanding all the different symptoms that can show up, and being a good observer of behavior and asking questions and being proactive and your kid's advocate for sure.
How often are people misdiagnosed if they don't go to a specialist or someone who's really familiar with concussions?
They get missed a lot, which is probably why our statistics are so off. I had a recent experience with my grandson who fell out of bed. And he was crying. Nobody saw it happen, but he was clearly distressed. And the next day, he had what looked like a seizure. So, of course, Grandma made sure that he went to the neurologist, and the neurologist said to me, "Oh, don't worry about it. He didn't have a concussion. He didn't lose consciousness." Well, that's another misconception, is that most people do not lose consciousness when you suffer some kind of a concussion, and the jury's still out. Did he sustain any kind of an injury? He certainly did have this associated reaction afterwards. And, when you see something like that, we really need to be super careful for the next 3 to 4 weeks until that brain heals completely. Because you think about those little, telomeres or neurons, if, they break, the next time, each time they break a little bit more, and we don't want them to break completely. That's when you get into some dangerous territory. So knowing that kids' reaction time is off for the next 3 to 4 weeks, and you see something and you are concerned about it, then just err on the side of caution.
Absolutely, there's no harm in that.
That's right. Yeah.
All right, let's see, make sure we have all the questions here. Okay, is there anything else you'd like to leave us with, or one more time too?
Okay, so concussion-therapy.com or iptkids.com.
All right, Dr. Sally, thank you so much.